Assalamualaikum and hi miss, my name is Alea Athirah binti Syaful Izan, a dental year 3 student. Today going to assist you the oral hygiene instructions. First miss, you need to know some basic tooth anatomy that might be helpful for your treatment and for your better understandings, which are gums, periodontal ligament, cementum, and alveolar bone. You might be wondering what are those? Gums is actually a pink-colored soft tissue in your mouth that surround the bottom part of teeth and cover your jawbone. Periodontal ligament is made of strong fibers that act as a specialized cushioning like a shock absorber when you bite, an anchoring system that holds your tooth in its bony socket. Cementum is a thin layer that covers the root of the tooth and helps attach the tooth to the bone. Last but not least is alveolar bone. It is a part of the jawbone that supports and holds the teeth. Okay, miss. So you need to know the periodontal health and its disease. So periodontal health means that the healthy gums in the bone that holds your teeth are in place and is stable. You can see in the picture that in the healthy gums, they will look pink and firm, not bleed when brushing, not feel swollen or painful, and it also can hold your teeth strongly. So when the gums are healthy, the teeth can last a long time. Okay, miss, you might be wondering how does this relate to you? And since you have diabetes can make your gums easier to get infected, which is to get inflamed gum, or you can call it redness to your gum. And your gum might be slower to healing, and it is more sensitive to plaque buildup. So when there is a plaque buildup, it can lead to reduce to your alveolar bone to your gums. As you can see through your intraoral photos that has been taken, you have some plaque and calculus deposits that have been accumulated around your gum line, which are between your gums and your tooth. You can see at the left photo, there is bone recession or gum recession. There is gum recession on your tooth 3-5. Okay, miss, you also need to know the progression of a periodontal disease. So first, we have healthy gums, and these healthy gums, you can see that your gums is still in pink gums and there is no bleeding with brushing or also flossing, and you also have a fresh breath. The second stage you have is the gingivitis. Gingivitis is actually the second stage, which you can see there is a plaque inflame the gums and bleed easily, which means that your gums is in red because there is a bleeding when you brush and also flossing. You can smell a little bit of bad breath, but there is no bone loss or no tooth mobility. So for the third stage, which known as mild periodontitis, so for mild periodontitis, there are the beginning of bone and tissue loss around your tooth. So it's still the same as gingivitis, which is red gums, bleeding gums when brushing and flossing, and there is possibility of tooth mobility. For the fourth stage, which is moderate periodontitis, in moderate periodontitis, there will be more bone and tissue destruction, which cause moderate bone loss and tooth mobility that can expose your tooth root. Last but not least is a severe periodontitis. This severe periodontitis is actually an extensive bone and tissue loss, where the teeth may become loosed and there will be a severe root exposure. Okay, miss. Now, I would like to explain to you your gum condition in simple terms based on your periodontal charting and also your x-ray. First, let's look at your periodontal charting. This charting measures the space between your tooth and your gum, which we call it a gum pocket. Normally, a healthy gum pocket is about 1 to 3 millimeters. But in your charting, the red highlighted numbers shows that the areas where the pocket depth is deeper than normal. So this means that in those areas in your gums have pulled away slightly from the teeth. In our mouth also have germs and bacteria, and these bacteria can go deeper under the gums. These areas are harder for us to clean or for you to clean with a normal brushing. And these deeper pockets are a sign of gum disease, and we need some professional treatment so that we can prevent further damage. Okay, miss. Now let's move on to your dental x-ray. This x-ray was taken before your teeth number 38 and 47 were removed. From the x-ray, we can see the bone that supports your teeth. So, in your case, we can see that some bone loss, and the pattern of the bone loss is vertical bone loss in certain areas. So, vertical bone loss means that the bone has reduced unevenly, and this is a sign of periodontal disease and not just a gum inflammation. So, what does this mean for you? Because you have a deep gum pocket, there is a bone loss seen on the x-ray, and you have a diabetes even though it is controlled, it means that your gums are more vulnerable and need proper periodontal treatment and a close monitoring.
Okay, so now I will be explaining on the importance of plaque control. So, what is actually a plaque? A plaque is a sticky biofilms that is full of bacteria that adheres on our tooth surface and also along the gum line. And dental plaque is also known as the main driver that can cause gum diseases. Since you have diabetes, even if it is well managed and also well controlled, your gums can be quite sensitive and more strongly to the bacteria in the dental plaque. That is why it is very important for us to remove the plaque every day. And when the plaque is still soft, we can easily remove the soft plaque with a proper brushing technique and also cleaning at home. However, if plaque is not removed regularly, it will harden over time and it will turn into calculus, which will be hard to remove by brushing alone. Once the calculus is formed, it will act like a rough surface that allows more bacteria to stick around the gums. So now I will be showing you all of the oral hygiene aids that are really important for us to have at our home. So for the first one is a fluoridated toothpaste. A fluoridated toothpaste contains fluoride, which is really important in our oral hygiene routine. Why? Because fluoridated toothpaste has fluoride that is a very good antibacterial properties that can kill all of the bad bacteria. Other than that, it also helps to remineralize our teeth. Second, we need to have a soft toothpick. Soft toothpick can help to remove all of the food that has been stuck between our teeth, and as it is soft, it won't cause any damage to our gums. Other than that, we also need to have a floss, which is a floss thread. A floss thread can remove all of the soft plaque or food between the teeth and gums. Next, this one is really important that we need to have, which is a soft bristle toothbrush. Soft bristle toothbrush is really important for us to use because it can help to reach all of the pockets between the teeth and gums when we brush and clean it, and it also won't irritate our gum as it is soft. Next, we need to have a single tufted toothbrush. A single tufted toothbrush used at the area that is hard for us to reach, such as at the back of our mouth, which is molars, or also at the occlusal surfaces. Next, we need to have a tongue scraper. Tongue scraper is helpful for us to scrape all of the debris or also plaque on our tongue. Next, we have a fluoridated mouthwash. Fluoridated mouthwash is really important for us because it can help us to clean our whole mouth. Next, we also need to have a floss handle like this, because floss handle can hold easily for us to remove all of the food debris that has been stuck between our teeth and also our gums. It's really helpful because it can be easily controlled. Next, we have interdental brushes. Interdental brushes has a lot of size, and how can we find the size? First, we can help to try and find the size that is actually fit snugly between our teeth in order for us to remove the plaque properly. Last but not least, we need to have a mirror so that it can help us to ensure that we are performing our oral hygiene perfectly. So now, I will show you some of the demonstration of oral hygiene practice so that you can practice it at your home. So, the correct way or method that we use to brush our teeth called modified base brushing technique. So, by modified base brushing technique, you need to use a soft bristle toothbrush. Soft bristle toothbrush will prevent the damage of our gums, and also it is really helpful and easily to reach into our pockets of our teeth. So I will be start at the lower teeth, at the front surfaces. So first, we need to angle our toothbrush at 45 degrees and make sure that the toothbrush touches both the surfaces of your teeth and also gums. Your teeth and also your gums. Your landmark should be the border between your teeth and gums. So 45 degrees, and brush it away from the gum margin so that the plaque that is accumulated in the pockets can be removed away from the pocket and away from the gingiva. Like this. 45 degrees, brush it away. Next, for the inner part of your teeth, make sure you hold and angle your toothbrush at 90 degrees. At 90 degrees, by making sure the toothbrush touches both of the surfaces of your teeth and gums, and brush it away from the border like this. Next, at the back of our teeth, just do the same. Angle your toothbrush at 45 degrees. Yeah, angle at 45 degrees. And brush it away. Remember that your landmark should be the border between your gums and teeth, and make sure to brush it away from the gum margin. The same as the inner part. Make sure it is 45 degrees and brush it away. The same as this part. Need to make sure it is 45 degrees and brush it away. The same as the inner part. 45 degrees and brush it away. And as for the upper surfaces, or also known as the occlusal surfaces, you can just brush it normally or also vertically, like this. So, in the case, since you have extracted your molars of 3/8 and 4/7, you can use a single tufted toothbrush, this one, for the area that is hard for you to reach, for example, at the back of our mouth. So, we need to make sure that the bristle come in contact with the teeth at the most behind of our teeth in our mouth, so that we can clean the plaque that has been stuck there. So for example, you have been extracted 3/8 and 4/7. Here are your 3/7, so you can't reach at the back. So make sure you use your single tufted toothbrush and clean it like this, so that we can remove all of the plaque which has been stuck at the area that we can't reach, like that. The gap between your teeth is also one of the areas that the plaque is easily accumulated. We need to use interdental toothbrush that is fit snugly at the gap between our teeth to brushes all of the plaque away. You need to brush the gap of your teeth like this. Make sure it is fit perfectly so that we can remove all of the plaque away.
So next, I will be demonstrate you how to floss your tooth. So make sure that you have your dental floss, which we using the thread floss. And then make sure you take the floss not too short and not too long. So you take your middle finger, your both middle finger, and wrap the floss to your middle finger, side to side. And then take your index finger and your thumb, pinch it at both sides. I repeat, take your both middle finger, wrap the floss, pinch it, and floss it through the gap. Make sure that you pass through the contact point of your teeth and your gums. Make sure that the floss is hugging between your teeth and pass it up, so that we can remove all of the plaque that has been accumulated and stuck. So miss, based on our examination, you have mild to moderate gum disease. And the good news is that your prognosis is good. And at this stage, your treatment will be non-surgical, which we're focusing on the prevention and also the maintenance. So first of the treatment, we will do plaque scoring. So this plaque scoring help us to see where is the plaque that is building up on your teeth and which areas that you may be missing during your brushing. How we do plaque scoring? So plaque scoring, I will apply a special dye to your teeth. And your teeth may turn pink or purple, which is normal. The pink color means that there is a new plaque. It is a new plaque. And for the blue or purple color means it is a mature or older plaque. This will help you to understand exactly where to focus when you brush your teeth. And it also helps to motivate you to improve your oral hygiene and monitor your gum health over time. Next, I'd like to explain the treatment we're going to do for your gums, which called scaling and root debridement. So, scaling means that we gently clean above and also below your gums to remove plaque and hardened deposits, which we call it tartar. These deposits cannot be removed by normal brushing and are one of the main causes for your gum disease. I will explain to you the root debridement. So for the root debridement means that we clean the root surface of the teeth to make it smooth. So a smooth root surface helps the gums to heal, the gums to reattach better to the teeth, and it also helps to reduce bacteria or germs accumulated under the gums. This treatment is non-surgical and usually done in stages. So scaling is where we gently clean above and below your gums to remove the plaques and also hard deposits. This is how the scaling looks like, and this is how the root treatment being done. After the treatment, you may feel slight sensitivity or soreness for a few days, and this is considered normal, and the gums will usually improve as it's healed. So here is one of the example of the image from before the scaling and root debridement, and this is the after. As you can see, there is a plaque or tartar here, and after we remove it, it has been clean. So scaling and root debridement will help to reduce gum inflammation, bleeding, and also prevent your disease from getting worse. Okay, Miss, I think that will be all for your oral hygiene instructions, and I hope that you can follow all of these instructions so that we can prevent the further damage of your periodontal disease. And thank you.